Today we're talking about nose fillers. Filling your schnoz, can it be done? Of course it can. Hello TLCers, so today we are talking about nose fillers. But of course we're not just talking about nose fillers, we're going to do a whole bunch of other stuff as well, as that is my habit on this channel. So sometimes we have a problem with our noses. It's right slap bang in the middle of our face, and if it's a feature that we don't like, then it can really be a problem because there's no hiding it. It's not like, you know, if you've got a bum that you don't like or a leg that you don't like, you can just hide it. If you don't like your nose, it's right there. I myself had a rhinoplasty, that's a nose job to you and I, maybe around 2.5, 3 years ago, roughly. It was fine as a procedure. I went to go and see somebody who was really good. I was very happy with the results. He didn't change a huge amount about the nose, but he just made lots and lots of tiny little tweaks, which made it this joyous wonder that you see today. But if you're not in the market for a rhinoplasty, you either don't want one or you can't have one, whatever, you just want something quick, you can use dermal filler in the nose to either straighten it up or to disguise a little bump or to turn up the tip of the nose. And we can use all of these things together in order to give a good result. Let's take a look at our patient today. You have seen her before, and these are her pre-pictures. So if you remember, we did a little bit of Botox here, and then we ended up putting some filler right there on top of the cheek and in this area here where she's lost some volume. We also did the jawline here, the chin, and the base of the nose just here as well. Now, I have brought her back in and we're seeing her again, but as you know, with these things, often we need to do these treatments a couple of times in order to get a really good result. So we decided that we were going to do a little bit more cheek augmentation, and we were going to do a little bit more in the chin and the angle of the jaw, and then we moved on to the nose. One of the really important things that you need to know about the nose is that on a woman, the base of the nose, so where the nose starts, it should be in line with the lash line. And you can see on our patient, it's just a little bit too low. So what I'm going to do is add some filler in this area here, just to bring up where the nose starts and make it just come in line with the lash line. So it will look a lot better if we do that. Just check out her eyebrows. So if you remember when we first started, they were really super thin, and she's been using a lash growth serum called Lumigan actually on the eyebrow to try and make the brow grow a bit more quickly. And you can see that she's definitely got an improvement in the amount of hair there. Still a bit of a way to go, I know, but you know, Rome wasn't built in a day and all that. The next thing that we're going to do is just add some filler with a cannula just underneath the eyebrow. Now she does have a little bit of hollowness there. You can't really see that too much on the before picture, but you can see on the film just when I'm doing the treatment, it does make that brow bone just pop out a little bit more clearly there. And that's something that I tend to do for slightly older patients because you lose volume in that area with age. So now we're going to go on to the main event. So here I'm injecting the midline of the nose, just here at the top. And as I said, the aim of this is to make the nose look a little bit longer because it's just starting a bit too far down her face. Nose filler is fraught with complications because the blood vessels in your nose are a little bit more sensitive than elsewhere on the face. And what I mean by that is if you inadvertently inject inside a blood vessel, say here, it's not really a big deal because that tissue there is supplied by multiple different blood vessels all coming in from different directions. Whereas in the nose, you've got a lot of vessels, but they supply discrete individual areas. So if you block one of them off, it means that the skin to that area ends up, it's a bit scary, dying off. Or even worse, if you inject the filler inside an artery there, the filler can go flying off along the course of the artery, and in some cases it can end up somewhere else, which is bad. So you can have skin loss elsewhere on the face, and Unfortunately, it's also an area that is associated with blindness as well. Now, it's super unlikely to happen. But it is something that you need to be aware of if you are going to be having any nose fillers done. In my opinion, the procedure is better done with a needle than with a cannula because you've got more control over a needle. And actually, most of the cases where people have had complications which are serious, such as the blindness complication, it has been done with a cannula. So that's why I'm doing it with a needle right here. Now we're going to move on and inject the tip of the nose, and the point of this is to rotate it up slightly. I tend not to use any anaesthetic when I'm doing this procedure. It looks like it would be painful. It's actually not that bad. The filler itself does contain lignocaine, so that takes the edge off any kind of pain that she might be experiencing. Now we're going to go on and do some forehead filler. So if you've seen any of my previous videos, you will have seen that we can add some filler right there to improve the contour of the forehead, because having a round forehead is much more healthy looking than having something that's quite flat. So we're going to use a cannula to do that. And now we're just going to go and do a bit more cheekbone refinement. We did it before, obviously, but I do think that she could use just a little bit more to get that contour improved. Just going back to the nose filler. When you have nose filler, it's really important that whoever is doing your procedure for you understands the anatomy of the nose and how the proportions of the nose should work in harmony with the rest of the face. I have seen a few times somebody has had nose filler because they've got a great big bump in the nose, but then their chin is sort of quite stepped back, so the profile doesn't actually look any better. So when you are having nose filler, consider having some filler put in your chin as well to bring this whole unit forward. You may even need to augment the lip as well, because there are certain measurements that we look for when we're looking at you from the side, and if for example your chin is much further back than the nose and the lip, it can look really weird. So that's one of the ways that we have to improve your facial harmony. Okay, so let's just have a quick look at her nose in profile. You can see on the video here where she's just turning. We've got a bit of an improvement there, and in the forehead. Right, so let's check out after pictures now. So you can see it in the afters, we've got rid of that bit of hollowness that she's got going on underneath the eye before. All this area here looks all lovely and smooth. Just to reiterate, the brows looking a lot better as well. I'd still like to see a bit more width there, and a little bit more lusciousness in the hair, but I think that's just a matter of time really. If we have a look at her cheek shape, you can see that she's got this lovely light reflex there and a little bit of shadowing right underneath. We've got good angle of the jaw, and her lower facial third has got a nice point to the chin, and we've increased the height of that as well. So I think all in all, looking pretty good. Okay, that's all we've got time for this week. I hope you enjoyed the video. If you've ever had nose fillers done, or you're thinking about having a rhinoplasty, let us know in the comment section below. I'll see you again next week, and in the meantime, don't forget to like, comment and subscribe.